Hello and welcome to Module 1.2, Understanding Health Insurance Literacy as Health Professionals. My name is Jean Edward. I'm an assistant professor in the College of Nursing at the University of Kentucky and nurse scientist for Markey Cancer Center at UK Healthcare. In the previous module, we learned about the concept of health insurance literacy and the impact it has on our consumers nationally and in Kentucky. This module will focus on the importance of understanding health insurance literacy as health professionals. We will look at systems-wide approaches to understanding and addressing health insurance literacy, how we can better engage consumers in their health and in healthcare. We'll also discuss what a health insurance literate healthcare system needs to do and what a health insurance literate consumer needs to know. And we'll discuss ways to improve health insurance literacy and support decision making, as well as discuss your role as information intermediaries in promoting health insurance literacy in our consumer population. We start again taking a look at this image. In the previous module on health insurance literacy, you were introduced to the concept and research that highlights the impact that health insurance literacy has on our consumers, the ability to understand and process information related to their health insurance, and to use that health insurance to make timely and appropriate healthcare decisions. As policies around health insurance continue to change, selection of health insurance becomes more confusing for our consumers. For example, with all the confusion around the removal of the individual mandate of the Affordable Care Act, people are wondering whether they need to have health insurance legally, and some even contemplate whether they need it at all. Also, states have changed Medicaid policies, leading to confusion, especially among those individuals who may have gained coverage under Medicaid expansion in states that chose to expand Medicaid under the Affordable Care Act. So the big question here is, what do we as health professionals need to do? What is our role? And what is the role of the healthcare system in supporting the consumer? And also, how much responsibility should be placed on the consumer to engage with the healthcare system? We strongly support the view that the responsibility to address our health system barriers, especially those that pertain to the lack of engagement among our consumers, is a shared responsibility. We really need to take a systems-wide approach to address the issue. And when we say systems-wide, we mean across the entire healthcare system, not just a provider necessarily, or an insurance company or a managed care association, but everybody. So in one of its consumer reports, Alterum's Healthcare Value Hub said this quote, "Consumers should not have to bear the brunt of poorly functioning healthcare markets that don't deliver value." So it really makes us think about the idea of responsibility of the consumer when the healthcare system is flawed and has many areas of concern that we ourselves as professionals, as healthcare providers and individuals who are part of the system are grappling with. Therefore, while we look at what our consumers need to do in order to make informed healthcare choices and be engaged with the healthcare system, we need to equally, if not have a higher focus on what we as a system can do and look at ways to improve the system so it is more consumer friendly. So as researchers, we base our work on theoretical and conceptual models. Basically, these are models which have been tested in research and show the relationship between different concepts. And regardless of what area of profession you're in, your practice is evidence-based, and this is really where the evidence comes from, these models. This particular model that you're looking at by Mittler and team depicts a model to help us understand how consumers can be engaged in their health and the healthcare system. As you can see here, The oval shape includes some key elements of the individual, as in how they recognize their role in their own health and where they stand in their healthcare, how they gather information and weigh options, and finally, how they engage in a healthy behavior. But as you can see, these individual characteristics are encapsulated in group characteristics and community characteristics, which include a number of social determinants of health. And you can find these listed under the other key characteristics by level box. As you peel back the layers of this onion, you can see that the group and community characteristics are not very simple. They are pretty complex. I've circled in blue the characteristics that are especially important and hard to change, such as political and economic resources under group characteristics, and integration of groups, physical infrastructure, and health systems infrastructure under community characteristics. While these may be hard to change, they are absolutely essential in order to support consumer behavior. For example, going back to the Affordable Care Act, despite some believe its shortcomings, it changed national health policy to allow people to have equitable access to health insurance coverage. This change in law and the individual mandate to have health insurance coverage have helped encourage consumers to engage with their health and healthcare. Keeping in mind that policies and political leadership change constantly, the need to continue building on work to engage consumers with the system is absolutely vital. So here are some suggestions from Alterum's Healthcare Value Hub on what a health insurance literate healthcare system needs to do or what it could look like. There are three main areas of focus included in being a consumer-friendly healthcare system. And that the number one thing is thinking about benefit design to be more consumer-friendly. Are we discussing affordable cost-sharing options? Are we providing information that's usable to the consumer that's value-based? Do we feature high-value provider networks? And do we urge providers, hospitals, drug manufacturers, and medical device makers to address high healthcare costs? Currently, we're being challenged in doing these things. So definitely rethinking benefit design to be more consumer friendly is an important and essential way to go to transform our healthcare system. The second aspect is related to new models to reduce spending. So for example, we need to rethink provider-directed care. We need to provide usable shopping tools to our consumers. We need providers to be stewards for patients' healthcare and helping them make high-value healthcare decisions. There are many provider payment reforms now going into play, and that's a great step forward. We need to look at grouping care into treatment bundles and paying for value as opposed to volume. And that's really key. The focus on value is an absolutely essential component, and we have certainly changed our healthcare system to start moving towards that. Finally, we're talking about transparency on prices and quality. So where can a consumer go to find prices and the quality level of doctors and hospitals and nurse practitioners and the treatment choices that are available to them? And also, where can they go to make those price comparisons on health insurance and helping them make decisions on what works best for them? So there are many opportunities and possibilities to change the healthcare system to make it more health insurance literacy friendly. So we talked about what we can and need to do collectively as a healthcare system. There are some major changes that need to happen in order to support consumer activation and engagement in healthcare. However, there is a most specific, unique, and essential role that you, as health professionals, whether you are providers, community health workers, application assisters, extension agents, patient navigators, or anyone in these supportive and essential roles in our community, you play an important role in supporting informed healthcare decision-making among our consumers. So going back to our research models, our conceptual models, Hibbert and Peters developed an initial research around patient activation, and they developed this model on showing us how we can support informed consumer healthcare decisions. As you can see in this model, there are many strategies that can be used to help support consumers. And I've highlighted two that are specifically important in health insurance literacy and to this training specifically. And that includes decision support tools and information intermediaries. And we'll talk about those more in the next two slides. Decision support tools are tools that can be used to help consumers make decisions. These tools can be used independently by the consumer on their own, or they can be used in conjunction with in-person assistance or support. Unfortunately, most of the time, these tools do have to be used with in-person assistance as we have found them to be most effective, but may not be as efficient because we don't have that in-person assistance all the time. Here are some examples that I have pulled that are decision tools that focus on health insurance decision making. Show Me My Health Plan is an online health insurance decision support tool that an individual can just access by themselves. It helps simplify health information. It assesses and reviews the consumer's knowledge. It incorporates the family and individual health status to personalize the out-of-pocket cost estimates, and it provides preference for plan features. Another program is called Smart Choice Health Insurance. It's a workshop-based program out of the University of Maryland's research team that provides training via extension agents to consumers to help make informed health insurance choices. And there's also eHealth, which is an online program to help make insurance decisions, and it's a tool used by Aetna, United Health, Kaiser Permanente, Cigna, and Humana. And there's also healthcare.gov, and all these tools are available and they're growing, but these are the ones that I've known that have been tested in research and are quite popular among managed care organizations as well. So going back to the model on consumer decision making and how we can support it, we talked about decision support tools, and those are absolutely essential. But something that we believe and the research has shown to be more essential is the role of the information intermediary. So this is a person who stands in between the consumer and the information and accessing the information. An increasingly recognized resource used by consumers to obtain health insurance information is an information intermediary. And these include community health workers, navigators, other outreach workers who play key roles in translating and transmitting health information to consumers, especially those in our underserved communities. As a result of healthcare reform, information intermediary roles have expanded to include insurance application assistance and health system navigation assistance. Many of you may have previously been in that role or currently still are in that role. Studies document that compared to the usual care, availability of information intermediaries and their ability to provide decision coaching to consumers can significantly improve knowledge, participation, and improved satisfaction with the decision-making process among consumers. However, as the number of available information intermediaries dwindles due to the lack of funding, underserved communities face additional barriers to gaining assistance. Therefore, your role as an information intermediary, regardless of who you are and what type of role you have, is absolutely essential in improving consumer health insurance literacy. Time and time again, research shows that people like to work with people, especially when it's such a complicating and sensitive subject related to health and financial well-being and making decisions around health insurance literacy. Now that you understand the importance of your role, what are the key and essential things that you need to be able to support consumers to do? A health literate consumer should have an understanding of these main concepts. Once again, from um, the Consumers Union Healthcare Value Hub, we're looking at some basic things that a health insurance literate consumer should know. Our whole training is based around these concepts. Each of our modules will help your consumers with these tasks. Each of our modules will help you understand, take away resources and skills to help you assist your consumers in each of these areas. We do want our consumer to have a basic understanding of health insurance and why we need health insurance, why we need the coverage. Secondly, we want them to be able to shop for coverage, that they know what options are available to them, that they know where to shop and how to get help. So once again, thinking about those decision support tools and our information intermediaries. We need for them to understand how to compare plans, that they can understand why this plan has a higher premium and a lower deductible, and why which plan would work best for them to reduce their out-of-pocket costs, and also to make sure that they have adequate coverage and that they're able to access the provider network that they need to access with the coverage that they purchase. And finally, and sometimes most importantly, is that once people have coverage, it doesn't necessarily mean they know how to use it appropriately to make those timely and appropriate healthcare decisions. So they need to know how to use their insurance. They need to know how to identify and use the in-network providers. They need to understand their explanation of benefits when it's mailed to them. They really need to understand their consumer rights to appeal and submit grievances. And how to get help and when to complain are also absolutely essential, because oftentimes the system is not perfect and consumers may get a bill or not understand why they didn't get coverage for a particular treatment. And so they definitely need to know and be empowered to speak up when there are issues with their coverage. Our whole training will also help you implement easy strategies to help identify needs of your consumers and communities and establish a plan of care for them. The training modules are designed to help you assess health insurance literacy needs of your consumers that you work with. It'll help you identify available resources. It'll help you develop a plan and select appropriate tools and/or programs to support your consumer needs. It'll help you implement or even evaluate those tools once they're put in place to make sure that it's working. One thing to remember is that healthcare is in a constant flux, especially health insurance policies. So a tool that may have worked 2 years ago or even a year ago may not work now. So we need to constantly reevaluate the needs of our communities holistically, and in looking at political resources and those changes and infrastructural changes as well, to make sure that the programs we have in place to support consumer health insurance literacy is still effective and makes sense. It's contextually appropriate and makes sense for the political climate that we're in. So finally, I want to conclude with saying that you as information intermediaries are an invaluable asset to our consumers and to our healthcare system. You play an important role in supporting not only the health insurance literacy needs of our communities, but many other areas of need among our consumers. So as you think about taking the following modules in the training as you move forward, it's important to ask yourself how involved you want to be in this process. Obviously, you are here to take this training, so you do want to be a part of this process. How comfortable are you with health insurance terms yourself? And how comfortable are you providing counseling and navigation services for the communities you serve? Just because you may not be 100% comfortable, it doesn't mean you cannot help that consumer, get them to the right resources, get them to the right people, and that's an important piece to remember. And also ask yourselves, what resources do you need to be successful? And don't limit that to just your institution yourself or your training yourself, but also thinking about the larger picture of the changes we need in healthcare policy nationally, statewide. What can we do? What movements can you be involved in to help change policies that impact all our consumers? Once again, I've attached some resources for you to refer to, mostly related to the decision support tools that I discussed. And finally, here's my contact information. If you'd ever like to reach out to me with any questions or concerns, I would be happy to speak with you. Thank you very much.